Services Board agenda. With that, I entertain a motion to approve the agenda.
So moved. Second.
And vote. All in favor, say aye. Opposed, same sign. Motion carried. With that, moving on, I'll entertain a motion to approve the minutes of the May 14th, 2024 meeting.
Move to approve the minutes.
I'll second it.
Okay, any discussion? With that, we will have a vote. All in favor signify by saying aye. All opposed, same sign.
Aye.
Aye.
Motion carried. Okay, public comment. We have anyone from the public who'd like to comment? Kay? You step forward, and I think we probably all know you, but if you want to introduce yourself, that'd be great.
Yeah, good morning, everybody. My name's Gay Magnifici, and I'm interested in being a citizen member of this committee. So I've spent my entire life in healthcare. I graduated from Amory High School a long time ago. And after graduation, I began working at a state institution for the developmentally disabled, which housed over 5,000 patients at the time. And while working there, I went to nurses training and became a registered nurse. I worked in the neonatal intensive care unit, general peds, the emergency room. I did oncology for 10 years. And the last 10 years or so, I did sedation and procedures. And I retired from nursing back in 2017. In 2018, I was elected to the Wisconsin State Assembly, representing the 28th district, which currently includes most of Polk County, and then in St. Croix County, the city of New Richmond, the village of Somerset, and the town of Star Prairie. I have, while in the legislature, this is my third term. I've been a member of the Health Committee and Aging and Long-Term Care, Mental Health, and Substance Abuse and Prevention. I did have a couple of bills that did pass out of the legislature and were signed by the governor. And both of those address workforce violence in the hospital. It made a felony to commit battery against the nurse or anybody else that was working in the hospital. And then the last bill that I really wanted to get passed was the APRN bill. And that has to do with nurse practitioners being able to practice independently within their scope of care. The last two sessions I've worked on that, and the governor's vetoed that bill both times. It really would have helped our area up here because there's just a shortage of health care. But I've really enjoyed serving in the legislature. I've always thought that it was like nursing. It's just only taking care of people in a different way. I'm retiring at the end of my term in January because I never intended on being a career politician. It's time for some new blood and some new ideas. And I was just honored to serve. So thank you for listening.
Thank you, Gay. Is there any other public comment?
For all your service, sweetheart.
Okay, with no other public comment, then we're going to move on. Do we have any receipt of information from supervisors not seated as members? Do we have anybody here who has anything they'd like to present to us? Does not appear so. So then we will move on to our veteran services presentation. Good morning.
Good morning. My name is Andy Butzler. I am the County Veteran Service Officer. So our office is located directly behind me here, across the hallway. So I'm going to give a brief overview of what we do day to day and kind of who we serve. So our primary mission is to serve Polk County veterans, their families, and survivors as effective advocates in obtaining all veteran benefits. So regardless if it's state, federal, local VA benefits, we're here to assist with those. So going over federal benefits, one of the primary federal benefits that we see veterans for is disability compensation. So if a veteran sustained any injuries or illnesses that are chronic conditions in the military, we can assist them with being compensated for those conditions. So one of the most common claims we file is bilateral hearing loss and ringing in the ears. I think it's safe to say all veterans were probably exposed to noise at some point in their service. Other federal benefits, education. So the Montgomery GI Bill is phased out. Right now, it's kind of like the post 9/11 GI Bill. That's the current one that we are basically applying for those veterans. Home loan guarantee program. So the VA does have a home loan guarantee program where the veteran utilizes a program. Basically, the VA guarantees a portion of that loan if they default on that mortgage. So it's an incentive for the bank to borrow to that veteran. Veteran's not required any down payment, no private mortgage insurance, and it's a fixed interest rate. Burial benefits, we assist with applying for those headstones, markers, burial flags, reimbursement of burial expense, and then we can do a pre-needs registration for burial in a state or national VA cemetery. The nearest VA cemeteries, there's a state one up in Spooner, the northwestern Wisconsin Veterans Memorial Cemetery. Absolutely beautiful up there. If you're ever in the area, I encourage you to stop in and look at it. It's phenomenal. So federal benefits continued. There's a program called non-service connected pensions. So that's for low income veterans that served during a wartime period. Essentially, the VA does not want to see any veteran or surviving spouse living in poverty. So we can assist with applications for those programs to increase their monthly income a little bit. VA healthcare, that's another huge one. So the main VA facility is located over in Minneapolis. There's also what's called a community-based outreach clinic. There's one in Rice Lake, Maplewood. So veterans enrolled in VA healthcare can utilize those outpatient clinics as well. Given our geographical location, many veterans in Polk County are eligible for a program called community care, where essentially they can get a referral from their VA doctor to be seen locally at a non-VA facility. So it's a great benefit for veterans, you know, especially elderly who can't or don't like to travel. So they can still be seen locally, still keep their same doctors if that's what they want to do. State benefits. So Wisconsin, right now, they offer a property tax credit for 100% service-connected disabled veterans. And Gay, you probably can speak to this as you know as well, but they've been trying to get that reduced down to 70% for many years. If and when that ever happens, that would be a huge benefit to Polk County veterans because basically veterans who are 70% service-connected would become eligible for this credit. So it's, you know, for 100% disabled veteran, they get all of their property taxes back for their primary resident and up to 1 acre of land. Wisconsin GI Bill. So veterans who are eligible for the Wisconsin GI Bill are eligible for 128 credit tuition remission to any Wisconsin technical college or university. And then the state also offers emergency aid grants for substance or for like dental grants, different things like that, emergency assistance. And then also Wisconsin offers a reduced fee for hunting and fishing licenses for service-connected disabled veterans. There's a state park pass and then a veteran identifier. As far as county benefits, so if you've ever gone to any of the local cemeteries after Memorial Day, you can see all the American flags and the medallions out there on the veterans' graves. Those are provided by the county or my department. We give those like the local American Legion posts. They go out and put those out for the veterans. Just a way of honoring them and showing that they are, you know, a former service member. We also have an emergency relief aid grant program. It's called the Veteran Service Commission Fund. We receive $1,800 each year from the state for this program. And then we also receive additional donations from local service organizations like the American Legion, VFW, things of that nature. With those funds, we're able to help those veterans in so emergency situations. Transportation. So veterans in Polk County, there's a transportation program. We partner with the Aging and Disability Resource Center for that. So veterans are able to get a ride to their VA medical appointments. Worst case scenario, they have a $30 copay for that ride. So they're picked up directly at their house, taken to their appointment, and returned back home. Other counties have it set up where they have to, get up early, go to a meeting location, get on a shuttle or a van with 6 other veterans, and they spend the entire day at the VA waiting for everybody to finish their appointments. So I like how it's set up in Polk County. It's a door-to-door service, and they're back home, in no time. So that's all I have.
Thank you, Andy. Does anybody here have any questions for Andy?
I
Yeah,
have one quick question. Approximately how many veterans do you service in Polk County?
So right now, my best estimate, and I don't have a solid number, but my best estimate, I have over 400 disability compensation claims pending.
Yep.
So that's 400 different veterans.
Thank you.
very good. Anyone else here? Anyone have any questions for Andy? Okay, thank you, Andy. Thank you for the good work you do for our veterans.
Thank you.
Okay, and then moving on, we have World Elder Abuse Awareness Day recognition.
Good morning. I'm Lisa Lasser, Behavioral Health Director. So June 15th is a World Elder Abuse Awareness Day, or we call it WEAD. And it is a day that was established. Claire, do you have the PowerPoint?
Here we go.
There you go.
Was a day that was established back in 2006. It was a partnership between the International Network for Preventing of Elder Abuse and the United Nations. So it's an international celebration and just a reminder to all of us to do our part to report our concerns about elder abuse. Just kind of talking a little bit about it. We need to act. We need to be aware of what the prevention activities are, making sure that we are making those reports as we see them come across. Slide, please. So some of the facts that I would say contribute to our increasing numbers of elder abuse is that, our population is living longer. We are presented with some opportunities to think about the major causes of elder abuse. And we'll talk a little bit about those. Some of them are ageism, social isolation. Those are all both major causes. Next slide. I wanted to provide some of the facts for you all. So these are our 2023 data points for Polk County. And the two I think that are most significant for us are our financial abuse as well as our self-neglect. You can see there were significant increases from 22 to 23 as well as from 21 to 23. Some of the questions I think kind of come up is why the big increase. There was a study done in 2023 by the Journal of American Psychiatry and the Law. And a lot of it was contributed to the isolation that folks experienced through COVID-19, through the pandemic. Also an increase in doing online banking and different things people weren't going out into the public, they weren't going to the bank, they weren't going to other public organizations. And so they were required to really rely on the internet, and there's been a lot of exploitation there, of course. So just want to recognize the community-based services team within the behavioral health department, and especially our adult protection team. They work really hard. Leah can attest to some of the work that those folks do. These are significant increases, and I think it's important for us to make note of that and be aware. So thank you very much. I appreciate it.
Anybody have any questions for Gail?
I actually do.
Pamela?
I'm curious on the 45 cases of financial exploitation. Were any of those cases criminally charged?
I believe, and Malia, you can certainly speak to that. All reports are made. We don't follow up in APS on what actually happens with them. So I don't know if Malia, you have an idea.
There are local criminal charges. We also had federal criminal charges in one. So oftentimes they go hand in hand.
I'm going to recognize myself. What should we do if we suspect a case of elder abuse? What should a person do?
Sorry.
Go for it.
The most effective thing is to give us a call here at Community Services, and ask to speak with the Adult Protection Access
Okay.
worker for the day. We have somebody that is on call throughout business hours every day to take those reports. They are screened within 24 hours, business hours, and determine whether or not they are screened in for further investigation or follow-up or screened out. We do provide a lot of information to folks, you know, ADRC, other local information that we can provide for folks, but the best thing to do is call.
And then your department gathers all the information and then that would get forwarded for possible charges or prosecution.
Yep, they would do that. And a lot of what our folks do is they'll do that investigation, find out what are the needs of the consumer. You know, our adult protection team also does guardianships and protected placements for folks. So the best thing is make that call. A lot of times we'll receive numerous calls about a single individual, and that just helps our team build a case, if you will, for follow-up and then working with Corporation Counsel.
If there is a significant concern, like someone is going to drain a bank account or do something, we can file what's called an adult at-risk restraining order.
Yeah.
And usually these are family members or close, you know, live-ins where the abuse is happening. And so we can get into court immediately and have the court review a request for that injunction. And then we can deliver that injunction to the person and it forces them to not interfere. But there are mechanisms that we can work together with APS and our office to try to protect those folks that are at risk.
Good. Well, thank you very much for all the information and for your work on that. Okay, agenda item number 8, we have our medical examiner update.
So I'd like to introduce Jamie again. I think
Okay.
she's been here once. We brought her in when she first came on board early in the year, and I think she's been running ever since. Jamie took over John Denny's position as the medical examiner, in which he held that position for 20 years. Jamie was an assistant under John, but brings a wealth of knowledge from Ramsey County Medical Examiner's Office. We were very happy to be able to bring her on as the chief medical examiner here. And now it's time to give a report on, I think we bring her in a couple times a year to this committee to report on what's happening in all things medical examiner.
I am excited to
Okay.
give an update.
Welcome. I don't think we've met before.
I don't think so. So first off, I apologize for my congestion. They're cutting hay by my house and I'm feeling it. So I do apologize for that. So I'm going to get right into it. I'm going to begin just giving a brief overview of the type of deaths and cases that our office has handled since the beginning of January. These numbers are from last week, so they have fluctuated a little bit. However, it's a good outline of the different things that we've seen. So far this year, our office has handled 125 cremation cases. These are registered hospice deaths and deaths considered non-reportable, such as, inpatient deaths, deaths in skilled nursing facilities that still need a cremation permit provided. So we do log that. Again, that's 125. Total within our office, we have had 56 scene visits. These are reportable coroner cases where a deputy medical examiner or myself needs to respond to the scene and investigate the death. These don't always guarantee autopsies, but so far we have had 38 natural unexpected deaths at home. These unfortunately include 1 infant death as well as 2 reported stillbirths. That seems, I don't want to say that's high because again, these numbers fluctuate. There's no data to support that statement. We've had 13 accidental deaths. These include motor vehicle accidents, accidental drug overdoses, as well as falls within the elderly community that have resulted in their death. We have had 2 suicides so far this year. Both have been gunshot wound suicides. We have 1 pending autopsy report. We've also had 1 bone comparison. A bone was discovered in a rural area, reached out to our CMEO pathologist, Ramsey County Medical Examiner's pathologist, just to have that final say that if it's not human or non-human. Luckily, they were non-human. We have also, one of our numbers is also referred to an old case from 1993, I believe, that was reopened in order for Polk County Medical Examiner's Office to get reports and documentation back from Ramsey County Medical Examiner's Office so that we have that information in office. Because as it stands, the only report that we had was just an old logbook. I want to make sure that Polk County cases stay within Polk County. So one of those numbers has been designated to getting back, and that is now back in our possession. So far, we've had 11 autopsies, 2 forensic scans from St. Croix Medical Examiner's Office. So we've been able to utilize different options to get good reports. Difficulties. So far within Polk County, there is an unfortunate trend of unclaimed remains. I think everybody realizes that we are in tough financial times. And unfortunately, funerals and cremations cost a lot of money. So far this year, since January, we have had 3 cases of unclaimed remains that do need authorization for disposal. One was a veteran. I worked with Veterans Affairs and Schuerman Hammer Funeral Home. We got him to Fort Snelling. We had 1 cremation after autopsy where next of kin just was out of state and refused to remain in contact. And so Polk County Medical Examiner's Office paid to have them cremated, and those ashes are currently on hold at a local funeral home just to make sure that we have this person in someone's care. We also had a case of discovered remains in Balsam Lake, verified with a local funeral home, and I spread the ashes on private property with permission. So we were able to have that person have a final resting place. There were unclaimed ashes from 2017.
And it was literally
It was in a bobber.
in Balsam Lake.
It was in Balsam Lake. We found these ashes and we discovered them in Balsam Lake. And so these challenges have brought up a potential need that it would be very beneficial for the medical examiner's office to have a possible scatter spot, which would be a county designated place for unclaimed remains. It would be nice to have a little memorial stone somewhere that we can somewhere where we can give these people a final resting place. As it stands, ashes are people. And unless Polk County has a plan put in place, me personally, I don't like that it's different every time. I don't like that every time we have unclaimed remains, we have to come up with a way to dispose of them. I would like a designated spot so that even if next of kin comes up years later, we can say, yes, this is where your loved one is. This is the policy that we have in place. This is the area. It's a nice area. There's a memorial stone. It's just something that I would like to see. We're growing. We have 2 new deputy medical examiners. We have Nicole Strom and Nick Otlow. We have also created a new contract with a local funeral home. The purpose of this contract was intended to solve the following problems: transport to medical examiners' offices for exams from the scene when next of kin is unavailable or unable to make decisions. Typically, if we need transport to a medical examiner's office, it is a very heightened emotional state for family members, and for me to demand that they name a funeral home of their choosing in that heightened state is a little bit unfair. So we created a contract to have a plan and put in place for transport. We've also created, the other purpose of this contract is to provide a base cremation cost for cremated remains. Because unless we have something put in place, each funeral home is going to have a different cost and it's going to be unreliable. So I threw a lot of information at
I
you.
think it also expedites the amount of time that deputies are waiting. for
Yes.
that scene.
It certainly
We can
does.
call the funeral home. They will come and get the remains, where we're not tying up all of
Mhm.
that deputy time, both on the medical examiner side and the law enforcement
Yep.
side.
And that is the intended use. Sometimes family, it's ultimately up to family, the funeral home they choose. If they choose a funeral home that's in the Twin Cities and we get in contact with them and they say, hey, we have a funeral, we have this, we have that, it'll take us 3 to 4 hours. And if we have a motor vehicle accident on a roadway, that's not a realistic timeline. So we can certainly tell them, hey, we have this option for this local funeral home under contract with Polk County to make removal, and you can pick them up from the funeral home. The intended use is to create a controlled environment for removals and transports and cremating unclaimed remains. And I think that's it from January.
Anybody have any questions for Jamie? Questions, comments? No, thank you, Jamie.
Thank you.
Okay, our agenda item number 9 is our Department of Children and Families Placement Update.
Morning.
Good morning.
So last time we presented on the placements in the Department of Children and Families, we had 9 big out-of-home placements, and I think the projected budget for the rest of the year was $1.9 million. Since then, we have,
This is the
Oh.
previous board, so we have some new members.
oh,
So they might not know what we're talking about.
yes, you probably don't.
Please, I'm having trouble hearing you.
I'm sorry, what?
Can you speak up a little bit, please?
Yes,
Having tr-
absolutely.
Thank you.
Okay, so last time we presented to the board, we had 9 out-of-home placements, and the projected budget for the rest of the year for those 9 placements was $1.9 million. That included 3 placements out of state.
Yeah, and we have more than 9 placements. These are the ones who are higher acuity, super high need kiddos that are requiring a level of care that's either putting them in a residential facility in Wisconsin, or when we strike out in Wisconsin, we always go to Wisconsin first. We have found that we've had to place some kids out of state.
Yes, we currently have 2 kids in Ohio and 1 child in Tennessee. So since that report, when was that? March?
I think it was April or March, yeah.
We've decreased our placements to 8, so 1 child returned home. And of the remaining 8, we have 1 that is coming home, hopefully in the next couple of weeks, to be reunified with his family. We're working, the case manager right now is working on getting services set up in that home. And we've got 1 that'll be discharging October 18th. We've got 1 that will be coming home July 12th. That child is currently in Tennessee, so he will be coming back home with his guardian. And we've got 1 that will be discharging hopefully in the fall of 2024. The remaining kiddos will likely continue to need residential care.
And I think we have some in the hopper too, waiting for, like, we've got some circling around, waiting for placements that will meet their needs. So we will be going back and forth. I think we'll just be bringing this report to the committee to keep you guys all updated on where we sit with placements. They can get very expensive and across the nation. So we want to make sure that you guys are aware of that. So as far as the financials on, I can't read that because I don't have my glasses on.
Right now, currently, our budget through April, we have spent 54% of our total budgets for placements. That was since April.
I'm sorry, what was that percent?
54%.
4%. Okay,
January to April.
January to April.
Lee, can you talk a little bit about why these kids are placed and who actually places them?
Sure. So these kids are placed for high acuity needs. They have physical aggression, sexual aggression, harm to animals, they're fire setting. They're not safe to themselves, to the community, to others, incestuous behaviors. And who's placing them is the workers down in Department of Children and Families. We go into court, we present everything, and then the judge makes that final order with the help of the Corporation Council.
Or sometimes the district attorney.
Yep, District Attorney's Office helps for the juvenile delinquents.
I am aware of that. I've
Right.
working with you for the last 100 years.
Yeah.
But it's important that everybody knows that because
Yes.
you're not the person that's making that final placement.
Yeah.
The judge often recommends that, and that's something that the county has to abide by.
Yeah, and I think it's important to note that placement is our last resort.
Yes.
We try to keep them in their homes, in the community as much as possible. So everything usually has been tested out prior to having to go for placement and court order.
Yeah, our workers work off of, it's called a pre-placement questionnaire. So it's about a 1.5-page list of everything that we could do community-based as far as family therapy, peer mentorship, CCS programs and behavioral health, respite care. So there's a placement checklist that we work off of, meaning that we're trying everything else before we remove them from their home.
And the reason I say that, and I'm not being facetious at all, working with Lee and working with Malia for so many years from an educational setting, they do everything possible to not place these kids out of their homes. But there are situations where they have to do that. And I guess I've been in court enough times with both you and Malia to understand that.
Yeah.
And that's a tough decision, especially not only for the kid, but also for the family.
Yeah, so we can give a little report on the behavioral health side too. We ran those numbers. If there are no other questions for Lee for the child welfare.
Just quickly, just to tag onto what Bill said. So then, once they're placed out, is that then determined like by the facility, how long they're in placement, how long the treatment goes? I mean, that's got to be somewhat complicated as well, as far as knowing and even trying to budget that, I'm thinking, because I'm guessing it's all over the spectrum, how long they need to be in external care.
Yeah, they get treatment plans and they've got goals to work towards. We have the workers, the team, which would be the family, the workers here at the county, and then the placement have monthly meetings, if not more. And we are talking about discharge planning the minute that they walk through the door. So what goals need to be met? What needs to happen to get them safely back home where they're safe and others around them are safe?
Sure. Okay, thank you.
And I think something that Lee has added to it is that holding the facilities accountable to meeting those treatment goals so that we can get them back home. I think previously we would see kids maybe staying a little bit longer than we would have liked to. But they've really taken an advanced step to, like she said, their discharge planning on day one when they walk through the door and holding that facility accountable, because we're paying a lot of money for those services and they need to be showing us what they're doing.
Lee, can you address, just so other members know, a little bit about Northwest Passage and placement of kids there, since that facility is very close to us here? And then also Lincoln Correctional Facility?
Yeah, so Northwest Passage is a residential center up in Frederick, Wisconsin, and they do 30-day assessments and they do a really great job. So the kids go in there for 30 to 40 days and get a full neurological makeup. They do sometimes a med wash and they get a correct diagnosis. They'll get really specific recommendations. So we do use this service for those kids where we're going, we've tried so many things and we're still really unsure what's needed. Like very specific, like they'll talk about what type of therapy the child needs, what type of interactions the caregivers need to have with that child. They'll give education recommendations and vocational recommendations. So we do utilize that service a lot. That's a short-term placement, 30 to 40 days. Northwest Passage is a pretty big system, so they have other residential facilities, one up in Webster, and then they have a girls' facility in Frederick as well. So we do utilize Northwest Passage. We like working with them, and it's also great for the family interaction too, because they're close enough so the child can have that face-to-face interaction with family, which is really helpful and can sometimes speed up that reunification, because then the parents can have that face-to-face in helping work through that treatment plan with the kids and doing family therapy, things like that.
And then Lincoln Hills.
And Lincoln Hills is our correctional facility. So if you think of Lincoln Hills as, it would be the juvenile prison system. I mean, for lack of a better term. I mean, JDC is kind of like comparable to a jail, and Lincoln Hills is comparable to prison. So in order for a child to be sent to Lincoln Hills to corrections, they have to meet certain statutory crimes. I think it has to be 6 months or more that you would spend in a jail that you have to qualify to get to corrections. Corrections is very expensive. However, they do get some treatment in there, but I think the rates for 2025 are $1,300 a day.
Oh, my.
So we,
Try not-
I've been here for close to 20 years, and I think in my time here, we've had 3 kids at corrections.
Where's Lincoln Hills located?
It's over by Milwaukee,
Union?
New London, no,
Winnebago County, I believe.
yeah.
It's on the down in the corner of the state. Opposite corner.
Okay, do we have anything else for,
Sure.
John,
oh, John, I'm sorry.
I went to a 3-day seminar last week, and although highway oriented, our correctional always comes up, especially with transportation. And the mental health is the biggest problem in our budget and for treatment and everything. It seems as though most counties, down around La Crosse and even St. Croix County, there's a facility opened up at Whitehall. Do you know
Trumbull
it?
County Healthcare Center. It's been around for
Yeah,
probably more than 100 years.
Yeah.
A long time, yeah.
yeah.
Institute for Mental
There's a
Disease.
couple of the big ones closed up, down around Eau Claire and in that area. And have you been in touch with Whitehall? Is there any chance that we can?
Yeah, we use them. We try not to use them because they're expensive too, but every now and then we have somebody down there right now. for
Yeah,
it.
we do.
So yeah, Trumbull County Healthcare Center we contract with them every year.
It's considered an institution of mental disease, just like,
think they-
Winnebago is.
Yep, they have a nursing, I think they have a nursing wing.
Yep.
They have an IMD wing. They also have some step down CBRF.
Yep.
So our gentleman who's there is actually in the step down, so he's getting ready to transition back home. They do a nice job there. Yeah.
Winnebago is so expensive and transportation costs so high that are the people that are using facilities that I met, were very well satisfied and hoping that could keep going. Although we're continually searching for.
Options, yep. We do have Amory Behavioral Health, that's adult only. Winnebago, I think a good thing about Winnebago is that the courts have work to do virtual probable cause hearings so that we're not having to go back and forth 3 times to get a person to their court hearing. So yeah, there's some things in the works. Try to reduce some costs.
That's the number one hope that someday that we'll get another facility. Yeah. The legislature, I believe, a couple of years ago, was it in 22, Gay? I think they appropriated the money to build a facility for us, but they didn't appropriate the money to run it, and it all went that way.
Oh, yeah, that was the private partner collaborative with the state and HSHS, in which they allocated
went
15 million to build those extra beds. And then unfortunately, HSHS pulled out of the Chippewa Valley, leaving the region high and dry for those extra beds that are needed in this area.
That's our number one draw right now.
Yes, Bill.
Fran, one more comment. I want to compliment Lee and Malia and Lisa and Tanya. I think for all the years that I've had the opportunity to work with them, they have your wraparound program when dealing with kiddos is phenomenal. They have a lot of people that are involved in that. You want to mention what the wraparound program is and how that works?
Sure. So there's a formal wraparound program called CST that's housed in behavioral health. But if you think of a wraparound just in general, it's no decision about me without me. So what that means is everybody's sitting down at that table. So the parents, the kids, the doctor, the psychiatrist, the counselor, any formal or informal supports that family has, and decisions are made based on a team. And there's assignments that go out. How are we going to keep this kid in the community? How are we going to keep this kid safe? But then how are we going to also support the school system? And how are we going to support the parents at home? And so, and the child and the family is there at the table, and it's no decision about me without me. I think that that's not a new way of thinking, but different, right? Sometimes it was a lot of professionals sat in a room and we thought that we knew what was best for that family and that child. And this is a new way of thinking of it, of giving that child and those parents a voice. And that can be really motivating. And I think supportive to them. And that's where I think you're going to see that big change.
And I would add that within the Comprehensive Community Services Program, we call it CCS. You'll learn a little bit more about our acronyms later. But wraparound is expanded to not just children anymore. We are expanding that to adults in those programs. And so across the Western region, we're looking at how do we build wraparound into any service that we provided. So behavioral health, a few years ago, we conducted a wraparound study and assessment of where we are at currently for the behavioral health department. It's a slow process. And so right now we're working through getting wraparound implemented across our CCS programming. And from there, we'll start expanding, looking at clinic services, community support program, all of the services that we provide, and making sure that we are involving all decision makers in that process of planning what the needs are for that consumer. So it's really exciting, actually.
You know, I just look at it, what's in the best interest of the kid.
Yeah.
And that's why I want to compliment you for doing that.
Thank you.
Okay, so I did mention the mental health on the behavioral health side. We're running pretty good for budgets as far as placements. Winnebago is high. It's always high, but it's some of the other placement costs are a little bit lower, so it's balancing right now. We keep an eye on that too, so we can bring that back to this committee whenever, every month if you guys would like that.
Okay, Tim?
I just have lots of questions today, sorry. So I understand these are incredibly expensive and they're obviously very intensive as far as the amount of contact and treatment. Is there ever, and seriously, this is just a question, it's not an accusation, is there ever any financial support from the family at all in any of these situations? Or is this all a county responsibility, state statute kind of thing?
Every person who walks through our door is assessed for financial ability to pay, basically, either through the court system, through child support on the kids side, or through our process for adults on the behavioral health side. So everybody is assessed for what they can pay. Winnebago does that for us. So they make their every attempt to collect on either private insurance. There are some nuances where Medicaid will pay. So they do every attempt. By the time it gets to us and we're paying for it, which is usually the case, we are not allowed to make any effort to collect because it's already been done.
Sure.
Mhm. Yep. Yeah, and you will see on the orientation part, there's some client revenues that come in, so that's what that is.
Super, thank you.
Mhm.
Tanya. I don't think the cost of transportation is ever built though, is it?
It has not been included in Polk County. We are seeing a trend, though some counties are including sheriff's rides as something that they will bill back to the counties, but we have not done that here in Polk.
That's what's really hard on all the counties. One legislative leading Sheriff Knudsen from St. Croix County. He said right there, and the tears run down his face. He says, I don't have enough deputies, he said, to keep up the transportation and keep everything going in my county. And transportation and all this is huge.
I did pull some data from our statistics, and in 2023, we had a total of 36 emergency detention transports. And of that 36, the whole county sheriff did 16.
So we have a contract for secure transport. So we've paid for some secure transports as well.
And that's 7 of them. And they're expensive.
They're expensive, yeah.
Very expensive.
Yep. So, and that is a slight increase over the past 3 years. We had 27 transports in 2020, 28 and 21, 23 and 22, and then the 36 in.
So some of those other ones would be done by the municipalities.
Yep.
So it depends on where it happened. So Amory might have to do the transport or.
St. Croix has stuff to do.
Yeah. So we have the annual report, I think is next on the agenda if you guys are done.
Okay, if there's nothing else, then we'll move on to the next agenda item to establish, our 2025 budget update.
Yeah.
Well, okay, yep. It's just a matter of passing it out, so take one, pass it around, and you can read it. I don't think I need to give any explanation on it. You guys get this every year. It's a little bit different from the annual reporting that we do for the budget. It's more of a narrative and data points. So this year we changed it up to be a little easier to read, so give us feedback on that. It's still a work in progress. We used to give you a big old book with lots of words in it. And Bill read it every time and brought questions back. But if you have questions or suggestions, please send them our way.
Yeah, so if after we review this, you get a chance to look at it and you have any questions about it, you can reach out to Tanya, or if it's something that you want to talk about at committee, I let Tanya or myself know, and we will make sure and get that on the agenda for a future meeting. Okay, then, so moving on, number 12 is establishing budget priorities.
I think we're back to one, where the budget update.
Mhm.
Sorry.
Oh, I'm sorry.
The
I thought
annual
this was
report.
part of it. Okay.
Oh, no, sorry.
Okay.
Mine will just be a 2-second thing.
Oh, okay, thank you.
From the,
This is Sherry Poyer, our finance manager.
Another one, your right hand.
a little out of sorts this morning. Yes, I'm Sherry Poyer, finance manager, for those of you who don't know. I don't have a big update from finance perspective on the budget today. Most of that was, we kind of had the broad overview last month. Right now, this is kind of the big timeline of, where we intend to be going forward. And you can see the green dot for the now is the committee's considering priorities, which is your next agenda item. But right now, I just wanted to kind of let you know, everything has been provided to the departments from our perspective as far as their inputs for the budget, so that they can start working through everything and start working with you on committee priorities. If you have any questions about kind of where things stand, I'm happy to answer any of them, but it's kind of the ball's in your guys' court at this point. Got some due dates coming up in the next week or two for some of the items, fee schedules. Got the first drafts in, those should be coming through committees. Is that next month on the agenda? Okay, so next month, fee schedules should start coming through for a August board approval. And then from there, we'll have some more updates kind of going forward, but really not a whole lot going on from our perspective at this point, unless you have questions for me.
Any questions for Sherry? No? Okay, then. Thank you, Sherry. Okay, and then after our budget update, moving on is to establish our budget priorities.
You want to speak on that a little bit? I can add to. So every year we bring this before committee to ask for your input on what the priorities should be. And as you listen to us, and as you listen to us today, I think you can pick up on keeping kids safe and adults safe as one of our number one priorities, and having to also add on to that, having healthy communities. So most of our budgets do get tied up in those higher need, keeping kiddos safe, keeping adults safe. I think we're working on some initiatives through some of our leftover ARPA monies to try to get ahead of the need to have to go to Winnebago or out of state. So we're working as a leadership team on what would that look like and how could we provide some services to people who are in crisis to keep them in the community So we don't have to worry about transports. We don't have to worry about somebody going to an institution or an out-of-state placement. It just does nobody good. And the number one person that it does no good for is the person who has to experience that's the worst time of their life. We take them out of their home and we just don't have good results from that. So I think our team is interested in what can we do to back that up and get ahead of it. It's kind of Helen's pond and frog talk that we want to get in front of it so that we don't even have to worry about that as much as we do right now. So if the committee is okay with that, we want to be able to run with it and use some of our funding to be able to drill down on that. It would require some contracted services and some planning and that type of thing.
Thanks, Tanya. Yeah, it is a challenge. I mean, Tanya's group in the CSD division has quite a bit of challenges in there because these placements can really blow a budget out of proportion and how to budget that number off a 5-year average, a 4-year average, where 1 year can be easily $1 million over budget. So trying to find that sweet spot in the middle and follow the board priorities and the committee priorities is challenging. And new initiatives take time to get off the ground. You know, so there's a lot of planning that their group does for these initiatives to see the benefit possibly in the next year's budget cycle. So when you guys are thinking about priorities, remember it's just not a 2-month turnaround to get the initiative going. There's a lot of groundwork that needs to be done to get these kids placed and new programs in to see the effect on them. So it may take 2 budget cycles for a priority to get implemented fully on there. So my hat's off to Tanya's group for trying to stay within the budget and looking at that on offsetting those costs. Because at last budget, I mean, it was $189,000 a month for placements. Add up very fast on those that are out of your control.
Yeah, so if anybody has any ideas, we would welcome them as far as something to prioritize for 25 budget.
John?
I guess what I can say on that is it's really should be a priority for every one of us and people that we know, your families and everything. Keep at your legislators because that number 16 there in time, we have to have a facility built for inpatient people. Transportation and everything and just, I think there's 16 counties now that I know of that are working together trying to get the legislature on track that how bad it needed in northern Wisconsin. That's what's blowing everybody's budget.
Rita?
I have a question, Tanya. You mentioned the contracted services to try to hone down on prevention.
Mm-hmm.
Could you give us an idea of what some of those might look like?
Well, one of the things that I've circulated to a couple of the directors is, and this came from our COVID experience, creating more strike teams. So during COVID, we would strike team, go out to a targeted area, give vaccines. So maybe when I say contracted services, like we don't have the resources, staff to be able to go out and help somebody in crisis. There's crisis workers, but they're not going to sit with the person all night long. So like a strike team would be a trained up contracted vendor who could possibly go out and help that person through their crisis and continue to evaluate, and or a kiddo who things go wrong in the middle of the night and the parent says, you got to get them out of here. That's where we run into kids staying the night here and on their way to the juvenile detention center or somewhere else. So like if there's a way that we could get through that initial crisis with appropriately trained staff, contracted staff, that might be something that.
And you've been doing some work on identifying.
Well, we have a meeting coming up with a vendor to talk about what would they need and what would the rates be and all that kind of stuff. So it's very early in the development.
And that would also allow then for the caregiver some respite too while they're with that provider.
So having people with rational brains go in and help the situation, because if mom has no rationality, the kid doesn't feel it's not a good combo.
It escalates to
Crisis.
to a situation that maybe could be avoided.
Yeah.
Do we have any other questions or comments for Tanya or our staff this time? No? Okay, well, thank you so much. Item 13 is an update regarding housing. Oh, can you speak to that?
I believe that's on the program that was set up last year. We still have one applicant for that program. We asked for more detail on the project that was submitted last week. We'll be getting together our revolving loan fund committee once Mr. Wortham is back from vacation, and vetting that application and proceeding with the process.
Okay, great. It's good news to hear that there is, that's going to be, there's interest in utilizing it. I think. Anybody else have anything for Mo or anything about the housing? I think he covered that pretty well. Communicable disease report. Dr. Lagus, did you have something for us today?
Oh, yeah, there's, through my reading, currently the COVID is down, but there's worry whether we're gonna have a COVID uptick in COVID cases this summer. And the virus is changing again. So now we have a new JN 1K 1, 2, and 3 seems to be the most common things that are circulating. The other thing I'm sure you've heard in the news, the H5N1 bird flu virus, which is now infecting our dairy cattle. There's now 5 herds in Minnesota that have are infected, and there's now I think there's probably in a dozen states. Michigan is kind of hard hit, and there's some in Wisconsin. And so so far the milk that's and they think that it's in the udders of the cow, and then the virus is being transmitted through with the milking equipment, but the good news is that the virus does get killed with pasteurization. And last month, as I said, do not drink raw milk because in the herds that are infected, even the cats running around around the place where the milking parlors and so on, they have drank some of that milk and they have died in fairly large number. Even the mice are dying in numbers who are licking that milk there on the floor and where the cattle are infected. The other thing that I just read this week again was that there's concern with people, pregnant people with prenatal fluoride exposure in Los Angeles. Report was that there's an increased risk of neurobehavioral problems at age 3, such as autism spectrum disorder. So maybe we need to let our pregnant people know that maybe they should not fluoridated water or take fluoride pills especially.
Yeah, and you probably talk to your,
I guess I don't see too many pregnant women or even adults taking fluoride supplementation or tablets. That would be a recommendation for kids.
Yeah, so the other thing was that the high dose influenza vaccine that most of us older people had outperforms standard dose in preventable hospitalization. And if you are vaccinated for COVID, you're less likely to get long COVID. So there's, and nicotine alternatives found in vaping may be more addictive than nicotine in cigarettes. folks. These were kind of little tidbits that have come along. The best mask, if you need to wear a mask for immunocompromised people, would be N95 masks. So that's kind of my update for this month.
Okay, and can we have Helen speak?
Yeah,
We're keeping an eye on
course.
measles, especially measles right now.
Yes, so I'm happy to report, it's the measles has slowed a little bit nationwide. We have not had any more cases in Wisconsin, which is great, but we're still continuing to move forward with all our preparation for measles. Otherwise, this time of year, our respiratory diseases decrease, but then we've seen increase of enteric diseases and then also our tick-borne diseases. So we have in May, 14 cases of Lyme disease already, anaplasmosis. Chlamydia holds strong at 5, just like last year. So that's something we're constantly watching and trying to advocate for. That's about the highlights.
Sabrina, are you seeing anything in clinic that you'd like to comment about?
We are seeing a lot of Lyme. So I do concur that, like, we're seeing a lot of Lyme disease, a lot of tick-borne illness. We're seeing, I think we had an anaplasma case last week, so we're seeing some more of that. So a lot of education to the public in regards to tick prevention. So long clothing, stuff that repels ticks. I'm not a huge fan of chemical wise, but it is really the only thing that kind of helps and works in regards to putting that on your clothing or shoes or things like that. So we're seeing a lot of that, doing education on that. In regards to measles, I'm thankful that that's kind of coming back down, but I have connected with some local hospitals in regards to offering them more vaccines separate from the varicella vaccine, which we talked about last time. So we're now doing that. So people will hopefully take those vaccines a little bit more willingly than they would in combination vaccines. So that's good.
Yeah. Okay, thank you.
Just a quick
Yes, Rita.
There's another tick-borne illness, the babesiosis, that has kind of resurged out on the western or the eastern coast and is making its way this way. It's carried by the deer tick as well. And that,
Yeah, we did see, I did see some babesiosis when I was still practicing in St. Croix Falls.
I guess there's kind of an uptick in.
Then there's a Powassan virus that also can infect people. And there were a few cases in northern Minnesota probably 10 years ago and some on the East Coast. And there's no treatment other than if you end up in the hospital with it on a respirator.
Yep. And back to measles and outbreak and contact tracing and all of that. If we did have a case here, we have a plan. We know, especially in the school setting, the number of students who are not vaccinated or they haven't turned in their paperwork or signed a waiver. So we've been in contact and met with Malia's office, Corporation Counsel's office, and Judge Tolan to make sure that we are ready if something does come through, if we have to quarantine bunches of people. Okay, so I feel like we're somewhat prepared. I know Helen is sending out communications to the 3 medical centers in the county, just keeping them aware that we would, if we do come across a situation like this, we would only do the vaccines for the underinsured and uninsured, but otherwise we would be pushing them out to the clinics if they chose to have the vaccine. So I feel like we have a pretty good plan in place to be able to be ready for that if it should come.
Okay. Yes, John.
Chair, and I think on the items that we have left and agenda here, and as long as we had some discussion about Rita and Dr. Lagos, I'd like to make a comment on their appointment on the county board.
Do you want to wait till we get to agenda item 15 to do that?
Are we done with communicable
Yeah,
diseases?
it would fit under there.
Are we done with communicable diseases? Okay.
Get a comment from our chair too.
Okay, it looks like we're done with communicable disease report. So let's move into the citizen membership update then. John?
Does Mo want to kick it off with the update?
I'm sorry. Yeah.
No, I'm
Oh,
sorry.
do you want to update us on where that's at?
Sure, at the last month's county board asked to open up that for citizen member appointments to see if there was any other interest in that. right now. Currently, I've received 2 applications other than the current citizens that are on the board. So at this point, I'm evaluating those applications, looking at that, and we'll have my decision by county board.
Mo, do you need the current citizen members to submit anything or do anything for reconsideration?
No.
Okay, thank you. Thank you.
I
Tanya?
do believe that we asked the citizen members to speak to their interest and qualifications for continuing to serve. So do you want to?
Yes, so our citizen members, if you would like to, take a few minutes and talk about your interests and your qualifications and considering being reconsidered to serve, we'd like to give you an opportunity to do that. Would you like to start, Dr. Lagas?
Well, thank you. Well, I was on the board for about 5 years. Bev Larson and his successor about 5 years in the 80s. And now then I was off the board for quite a while. And then I got a letter and asking me to join the board late in 1998. And so I've been on the board now for the last 25 and a half years, since January 1999. And so when I retired, so my experiences, first of all, is 56 years of family practice. I was very interested in infectious disease. When Mike Osterholm ran the infectious disease meeting at the University of Minnesota, I attended 24 out of the 25 years to keep up my expertise. I'm also a co-investigator on a paper that was written at the University of Minnesota for PCR testing for Lyme disease. And so I've enjoyed being on this board for almost 30 years. And I was considered quitting 2 years ago when I retired, but I could not. I talked to 3 of my colleagues and nobody wanted to take my position. So I agreed. And this year when Tanya asked me again if I want to continue, I said, well, it's up to you if you want me. She said she did want me to continue. So, and so now I've tried to give you a report every month on what the highlights are around the United States and the world. And so one thing I didn't mention was if you do any foreign travel, make sure what the recommendations are from CDC or have your travel advisor figure out what immunization you need, because there's a huge infection rate right now in Saudi Arabia with meningitis, and the people who bring people who get infected with measles. And there was a Amish person that went to Europe about 5 years ago, picked up measles, brought it home. 50 people in her community got measles, and so it's all were unvaccinated. So make sure that if you travel, if I'm actually ready to retire if Tanya can find my replacement.
You have to find your own replacement.
Yeah,
You're invaluable.
thank you for all your years of service to the committee and to the county. And that's good advice on traveling. I've been doing some traveling and I always go to the websites and look and see if there's anything that we need to be concerned about or vaccinated for or whatever. So thank you for reminding us of that as well. Rita, would you like to speak next?
Sure. I just want to segue off of something Tanya mentioned about the measles and the vaccination, as well as Dr. Lagas. And I think one of the biggest roles I see as being a member of this committee is to provide at the health department to promote education, accurate understanding of health. And there's so many, contributing factors on the internet that are not always accurate. And I saw that early in my practice. I worked as a nurse practitioner in family practice, and internal medicine and, you know, the biggest concern the biggest offering I brought was educating people to really understand in just objective terms what the risks are. And I think there's so much hype about anti-vaccine and stuff. And so I want to talk with you a little bit more, Tanya, about what we do offer educationally, you know, and Helen, of course, too. But my it's been a privilege. I really hadn't worked in government agencies at all. I was in private practice, both in family practice and in internal med or Mayo Clinic. But I've learned so much in the last couple of years about how this agency works. And now I think I'm really ready to jump in and try to help out with some of the educational health promotion. Thanks.
Well, thank you, Rita, and thank you for your service, committee. Sabrina, would you like to go next?
Sure. So my name is Sabrina. I'm a family nurse practitioner locally. I started my career as a registered nurse in 2010. So I've been an RN for the past 15 years and a nurse practitioner in family practice for the past 8 years. I do have my doctorate degree in nursing practice as well. I started my nursing career in public health, actually. So I know public health in and out. I worked for Clark County Health Department. And then I also worked for Trumbull County Health Department as well as a registered nurse. I ran the reproductive health program for Clark County. I worked with the state reproductive health program. I developed guidelines for the reproductive health program. I did a lot with that, contraceptive care, STI prevention, screening, a lot of education in the community. Also did immunization clinics, worked heavily with the Amish population in Clark County. One of my actual doctorate projects was with the Amish population and increasing newborn screening rates within that population. So I've published research articles in regards to that. The screening rate in Clark County went from 0 to 100% with implementation of the project. So that was wonderful to see that happen. But I've worked in every aspect of public health. I've worked in the environmental health services aspect and well water testing. So I've done pretty much everything public health wise as a registered nurse. Knew I wanted to do more. So that's what drove me into my doctorate degree in family practice. Now I primarily do a lot of prevention education with my patients. I work closely with the HIV Resource Center out of Eau Claire. And we get a lot of resources locally. So I'm a big advocate to getting male, female condoms, dental dams, things like that in the clinics to give out to patients, adolescents, high risk sexual behaviors that we see a lot of to help prevent STDs, syphilis, chlamydia. We see a lot of chlamydia, of course, that sort of thing. I do a lot of PrEP treatment. I do a lot of expedited partner therapy treatment for patients that don't have primary care providers. I'm willing to treat those people as well. So very actively involved in regards to that.
Well, thank you, Sabrina, very much. It was nice to learn a little bit more about you. Yeah. Okay, and then now we have Bill Oliva.
I'm the odd person out. I'm the non-medical person here. I've been on the board for a number of years. I was appointed in 2008 when I retired. I don't think I retired.
I know the feeling.
I was at Unity School District for 36 years. Teacher, coach, athletic director, principal, interim soup, the whole 9 yards. When I left Unity, I got grabbed by UW River Falls. I taught down there for 10 years. They called me an associate professor. I don't know why. AP, whatever. And so I finally left River Falls in 2018, and now I'm semi-retired again. The only athletic or the only medical training I've had is dealing with athletic injuries for the last 50 years. So I've seen it all there. It's real interesting. My connection educationally with the schools in the county, I still have connections with the 8 schools in the county. And I still have a lot of connections with the university system. And I think Rita said it's kind of an honor and a privilege to serve with such a great group of people. Many of them I have served with before, and I pointed these people out that I have worked with, and I can't say enough about having those connections. I'm the liaison for this committee for the Birth to Three program. And there's some other anachronisms that go with that.
Children-in-law service.
Yeah, Helen always reminds me what all of those anachronisms are, and I keep forgetting what they all are. But I do serve on that committee. I'm also on the CJCC committee. Thank you, Malia, very much. And so there are just a number of things that I do. There's just a lot of kid connections that I have. And I am certainly, honored to be part of this board.
So thank you, Bill.
Can I just
Yeah.
add this?
I have one more comment. I want to thank many of the people here who have been gracious enough to come to the St. Croix Falls Rotary Committee and speak on behalf of the Health Department and in their particular, Andrew, our Veteran Service Office, and you have been twice. And some of you who haven't been there, I will be asking.
You're gonna get hit up. Nothing wrong with that.
And so just for informational purposes for committee, we marry together the two statutes for the Board of Health and the Human Services Board. So there are criteria that we have to meet for both of those. So we kind of put them together. So committee size is considered. We have to make our best effort to have a physician or a registered nurse. We have to reflect the diversity of the community. We need to have somebody who receives services or has a family member who receives services, and then the remainder can be citizens at large. So we have to blend those two together. So it is a little bit of a tricky balance. We've been lucky to have so many health representatives with the two, not only nurses, but nurse practitioners and Dr. Lagas for these years. So we check that box. And so if there are others, the statute does kind of dictate what we need to have as for the citizen membership. And there's also rules about a limit on county board appointees as well. So we can't have more than 2/3 of the committee being county board members. So we put all that together, and we'll learn, I'll mention it again at the orientation.
I was just going to mention too, just on a personal note, as having a family member, my spouse suffers from a Parkinsonian related disease called Lewy body dementia. Diagnosed when he was 55 years old. He is 59 now. He's living at home. He gets along pretty good. But Tanya's department here has, I've spoken to Tanya, and other members of the department have been very helpful to me personally, in dealing with his disease and, getting prepared for the progression of that, unfortunately down the road. And thanks. So I just wanted to share my personal story with you a little bit too.
And Fran she can serve dual roles. So she would be the person with a family member receiving services, but also a county board appointee.
Okay, if we don't have anything else with that, let's move on. Our next agenda.
Madam Chair, can I make?
I'm sorry, Johnny.
We're
Didn't see you.
talking about our appointees here. So last county board, it's been the custom, and I believe that we can have some of our own county rule rather than just going by all the Robert's Rules of Order. And so at the last county board member, when it came to the appointees, one of the board members said we're supposed to have a 3-year and a 2-year and a 1 year. I want to tell you, in 20 years that I've been on the board, until Dr. Lagas came along, there was never a doctor at a meeting. Maybe I've seen half a dozen times when there was a nurse there, and not even always another citizen member there. It was just a kind of a formality thing. And I don't know if you want to make a comment, Mr. Chair, but we are so fortunate, and this is the only time, and I think I'm in touch with most of the counties, and most of the counties do not have citizen members that really contribute. And we got the best people in the state right here. And so you people that have other county supervisors, be in touch with them, because I think that we have a right to appoint these people and people that we know that are actually service and active. And I want to see that if we go by term, somebody made a comment, well, here's other people are have a chance to be appointed. And yeah, and they will always reach out, you know, to our chair or to the administrator. Will always, nobody's ruled out, but we're so fortunate to have the people. It'll never happen again that we'd have this good a contributor. I think we all learned, we're all educated from the contributions of these 4 people. And if we go to terms and everything and kind of put restrictions, I think we'd have a huge mistake. You got some comments on that? We were taken pretty much by surprise when it came to the appointment, weren't we, Mr. Chair, that we weren't?
Well, yeah, I was a little bit miffed in the fact that we weren't actually following the so-called rules mandated to us. However, one of the reasons that I'm at these meetings more often than you probably want me around, but I'm trying to learn a little bit more. I've been around 20 some years.
We have.
I find this a fascinating committee, and I've never really participated in human services up to this point, and so I'm here basically to try to learn, and boy, I'm getting an education on what's being done in this area, not just our county, but I mean, this extends far beyond Polk County and 45,000 people. I mean, this goes statewide, and so I think it's one of the finest functioning committees that I've seen so far, and the rest of them, of course, are a little bit well. we have more controversy in other committees as we do here. This is pretty well uniformly interested in what they're doing, and it's to me, I don't know how to improve on anything like this except educate and let people know what's really going on here. And that's basically the reason I'm here. As far as the appointments, we're following the statute, and Mo will, I'm sure, will do the proper thing.
Okay, and Tanya?
Chair, just a point of clarification too, so that everybody's aware, staggered terms are not term limits. So there are, we have very long-standing members on this committee, both from the county board's perspective, with Supervisor Bonaprise, and now Supervisor Olson, but there are no term limits. I know that got brought up a couple of meetings ago, maybe at the county board level even, about term limits. So there is a distinction between staggered terms and term limits.
Thank you.
The statute does specify that.
Okay, thank you for clarifying that for us. Okay. Take a pause. I don't want to rush us along, but if we are ready, we will move on then to item number 16, which is, I find quite an exciting item, which would be discussion and possible action regarding resolution 2824, which would be a resolution advocating for an inpatient behavioral health facility northern Wisconsin. We'll ask Supervisor Olson to speak to that as the sponsor of that resolution.
Well, I would say I'm the sponsor, but I'm gonna defer to our chairman because I don't know how my name got on the top of it there, because
Biggest mouth.
Sign.
this is,
I would like to have somebody up there that's
you're just looking for a fall guy, aren't you?
do a good job of that.
So both of these, were brought to me by Chairman Luke, in a phone conversation, about 2 or 3 weeks ago, Jay.
About that, yeah.
Yeah, and so, yeah, I'm on board. Trust me, I have no problem with the fact that my name is on the resolution. My name's on lots of resolutions. And I think it's a matter of just working with other counties, working with legislators, and getting there. I don't think the getting there will be hard. At the end of the day, will the governor sign it? We have no control over that. I mean, we have some control over it. But I think as me and Chairman Luke spoke, Polk County isn't going to accomplish anything. St. Croix County isn't going to accomplish anything. But many counties banded together have the opportunity to accomplish great things. And I don't think, having been at meetings over the last couple of weeks since me and Chairman Luke spoke, just because you adamantly disagree with somebody from another county on one issue does not mean that you cannot completely agree on another issue. I was in northern Wisconsin last week, ran into a county board supervisor that you would think that me and that individual would agree on nothing. And I brought this up and they were like, let's get on it. We have the same problem. We're farther away than you guys are. So, I think it's a way to bridge gaps, and I don't think getting counties on board is not going to be hard. So, with that, yeah, it really is. It really is. Both of these are Chairman Luke's ideas.
Well, the reason is no big idea. It's the fact of a need. We are losing representation up here financially for tremendous needs that we've been experiencing like everybody else in the state of Wisconsin and nationally. But and this has been going on for a number of years. Back in the 80s, they closed the colonies and normalized a whole bunch of people that really needed mental health and help. That seemed to be the start of it in my mind when I first recognized it. And it seems to be expanding on that idea of forgetting about us up here in this part of the state. Well, Brad brought it up and talking about mental health and the closing of Cumberland a few years ago and the closing now of facilities in Clare. And it's getting to the point where it's a real burden financially for us. And not only that, the subjective type things that pop up and some of the other departments that you probably recognize more so than anybody else in the county board, that some of these needs are having to be picked up by other portions of your services. So I figured Brad would be the guy that can get the message out verbally and efficiently. So, I mean, I know from my experience with him over the years that he's a hard guy to ignore. And
Have you tried? No, just kidding.
yeah, I can
Making an inappropriate joke. Sorry about that.
believe me, him and I have not always agreed on things.
That's why I didn't sit by you, Jay.
That's there's no physical contact. But I think he's respecting my age at that. However, I'm sure there's times he wanted to. But I guess you put that aside and in my mind, you choose the most appropriate, best individual that I can think of that we deal with that can accomplish something. And we need that seriously up here. So the need is what I was addressing. And Brad is kind of taking the bull by the horns now, and hopefully, and we'll give him every assistance that we can, right? Any stretch of the imagination, but and he's going to need more help. He's pretty optimistic about the acceptance, and I am too. However, accepting something is a lot easier than accomplishing something. And so we've got to help him in the long run to get something accomplished. And it's going to require a lot more than just a facility up here or by name and say, well, that would be a good spot for something. Well, we need funding. We need support from conjured up from a group well enough to show some interest in this part of the state. And that's going to require legislative action and legislative participation. And I know Gay's leaving, but I think she still has some influence on a few things around. And so we're going to rely on her expertise while she's still got a voice. And hopefully that's in Brad's itinerary. And so that's basically the reason for this this effort to get something accomplished that will benefit our tremendous need in this part of the state or any part of the state, but ours to be addressed more so than and financing is the answer, and that requires a lot of participation and a lot of verbal communications. It never hurts to have a big mouth in your side. Thanks, Brad.
Well, I just want to say as the
Now I know why I didn't sit down, because it could have gotten physical after that, Jay. So let me say this, and I'm not even gonna pick on Jay. It's just that we have a misunderstanding, myself and the chairman, of how long this is gonna take. When we started this conversation, he's like, Brad, this is gonna take years. I'm like, Jay, this is gonna take months. We've got a budget cycle in Madison coming up. There is not time to sit on our hands and do nothing, or we've lost it for 2 years. And so this is in my mind going to hopefully move along fairly fast. I think that, as I said earlier, I think the counties will buy in an instant, because we are all in the same boat if we're in northwest Wisconsin or if we're in northeast Wisconsin or northern Wisconsin. So I don't think the buy-in from counties is going to be hard. And getting some of the information that myself and Chairman Luke have talked about. It'll be legislative buy-in. I think that'll be easy, but when you've got 3 state senators across the northern third of the state of Wisconsin, it takes more than our 3 state senators to get there. And it will take a lot of buy-in from a lot of outside organizations, but there again, I don't think that buy-in is going to be complicated. It's just gonna take some time. It's gonna take some conversations. And after the chairman's comments today, now I'm out to prove him wrong. We're gonna get it done in a hurry, Jay.
Good. Love it.
I just have a question or maybe a comment on this
Yes.
resolution. So it's
Sabrina.
easy to build something, a facility like this, which I agree we definitely need. But I think the problem that we have in healthcare right now is staffing. So is there something like incorporated in this where we can, like incorporate some of the nursing schools or like, because how are we going to get staff to staff this? I mean, that's why hospitals are closing. That's why beds are not being filled. That's why people aren't being, transferred, really because of no staff to take care of these people. There's the facilities, there's the beds, there's no staff. And I think there's a lack of people going into healthcare. There's a lack of nurses. There's people leaving healthcare, providers, nurses, MAs. medical assistants. So how can we incentivize that part of it? I mean, I think it's easy to build something, it's easy to obtain beds, but how do we obtain staff? And I think, is that gonna be kind of a part of this discussion or conversation, like where you can incentivize people to, you know what I mean, go in?
I know what you mean, and Malia, correct me if I'm wrong, but I think that's why it's broad. You know, I mean, it doesn't narrow down on anything and say it's gonna be a building, it's going to be, you know, it's broad, so it can encompass anything. So I don't think there's nothing that's off the table in anything to do with it.
Incentivizing.
Yeah, I mean, there's so many nursing positions open right now and people are paying top dollar and people just don't want to go into that anymore. You know, because just with COVID and everything that's happened, it's really kind of ruined healthcare and it's going to take, I think, a while to kind of build that back up. So I just fear it's going to take longer than maybe we anticipate it going to take. We need it for sure. I have patients all the time that I have in crisis and that I have to send or transfer or do whatever with, but we struggle. We hold them in the ER for a long period of time because there's no staff to take them. We have beds, but we don't have staff. We hear all the time.
I see that.
So,
Thank you.
yeah, I think to try to really include that would be huge.
Supervisor Bonneprice?
She's exactly right. I mean, I think that's what the legislature seen was the foresight that we didn't have the staff. We came so darn close to buying the Baldwin Hospital before it was tore down. And now there's a situation in Eau Claire and Chippewa Falls where the facility will be available. And this is the #1 priority of 16 counties in northern and western Wisconsin. And the politics involved, which Gay can attest to. But I think they were honest that they seen that there wasn't enough staff to staff it. And I appreciate, we got to start over from grassroots and we're doing that here. And if we can pass it, and we'll pass this at the county board and I'll take it to the steering committee. We're starting over again in July on the 5 steering committees. And of the 5 resolutions last year, we never had one dissenting vote on the 5 resolutions. And so Polk County was, for the first time in history that I know of, had resolutions that were very favorable. And this will work. And again, it's the staffing that's the denominator.
Oh, go ahead.
I'm sorry.
Oh,
No, you go
Madam
ahead.
Chair, I'm sorry.
Rita?
Commenting just around the defining staff. And, you know, we might have to think out of the box as how we're going to staff something like this as opposed to the traditional, you know, nursing, because that is a career it's in flux. And when you get to mental health, there's a lot besides the physical aspects of the illness. And so I think if we could, in this committee, or if you have, you know, brainstorming groups or whatever, to try to define what kind of people would be able to be there and staff this kind of a facility. You know, I think I would be interested in helping with that.
I mean, we lack psychiatrists locally, right? Like I have a wait list, even to get someone in for an outpatient psychiatry visit is like 3 months. It's astronomical because we hardly have any psychiatrists locally. And the one we use is a nurse practitioner actually, and does a great job, but he takes forever, you know, for patients to get in. So I just to get a psychiatrist locally to do medication management for something like this. And we can't even get them to do outpatient, let alone I can't imagine trying to find someone right now to do inpatient. It has to be a pretty large incentive.
What they're talking about are exactly the reason that we're here with this is because the lack of the need, or the lack of response for the need here is when we were talking about this with Brad and we got, and others, it isn't hard to figure out that nobody in this area is doing anything
To coordinate it.
And not that we wouldn't advocate the initiative or the aggressiveness to accomplish something to a bigger organization or an organization that has more input than we do. That's fine. But right now, it's hit and miss. You were talking about different things already that we will, as a group, be addressing. But nobody's doing anything except specifically one thing here and one thing there. And everybody said, wow, we got a problem, but nobody has said, well, let's do something about it. We need a location. We need some treatment. We need organization in this area. And hopefully, the reason that I selected Brad was the fact that he has a good ability to bring people, get people's attention on issues, and something will be done as a result of it, I'm sure. Now, whether we have to follow through for months, years, weeks, or whatever, but until something stable or substantial gets going, I think this is a start. And Polk County is, somebody's got to take the bull by the horns, and I think we've got an opportunity to do so.
Dr. Lagus, did you have some comment?
I think this is a huge problem. Cumberland Hospital had the mental health facility there. Dr. Charles Mayo was their medical director, and they closed because they had a $500,000 deficit one year. And the hospital could not continue funding that. And so at that point, Dr. Mayo's brother was a family physician here, and he recruited his brother to come to St. Croix and do his psychiatry practice there. And so I think that for us, at least, the most logical location is Eau Claire. And because it's a big medical facility. Mayo has a hospital there, and Marshfield, and I think it has a hospital there, and or a clinic. And I think it's good you start the ball rolling, and when the county board passes this, please contact me. I have been on the Wisconsin Medical Society Legislative Committee for the last 10 years. And I'll be happy to bring it to the Medical Society Legislative Committee on July 19th when we meet by Zoom.
Great.
Well, thank you, Dr. Lagus. Did you have some comments?
Yeah, I just wanted to share, completely, we need more facilities. It totally makes sense. We have a lot of folks who, just looking at our numbers, our emergency detention numbers have outweighed our voluntary admissions in Polk County. But I don't want us to lose sight of the frog and pond analogy that Helen will share. Is the way we help keep people out of the hospital is we make sure that they have ready access to outpatient services. Right. It's the prevention piece that we're providing. It's the work that public health does. It's the work that Department of Children and Families does. But to Sabrina's point is there's such a lack of outpatient providers and outpatient services that we got to get people into those things to help keep them out of the hospital.
Exactly.
That's a good point to bring up. Well, everybody has kind of said their piece, I guess. Brad?
One more thing. So 2 months ago, I was in a meeting with a speaker that had nothing to do with mental health. It actually had to do with agriculture. And he started the meeting out with, do not be afraid to fail. Be afraid to not try. At the end of the day, I can't guarantee you this is going to work. But what we will know at the end of the day is that we tried. If we fail, it will not be because of lack of trying.
I guess as the committee chair, I just want to thank you, Brad, for stepping up and being willing to take on this complicated and important issue for our county. And
The first gentleman to my right over here did not give me a choice.
And if there's anything this committee can do to support you, provide you with, we do have a considerable amount of expertise here amongst us as well. If there's anything this committee can do to help support your efforts, please let me or Tanya know. If you need us to, get a minivan and all of us to go march around Madison with you,
That'll help.
we'd be happy to do that, as well. So thank you, Brad, for being willing to take this on. And if we don't have any, do we have any other discussion regarding this? I will entertain a motion. Actually, I would like to make this motion myself. To forward on to the county board with a positive recommendation to approve resolution 2824, which is the resolution advocating for an inpatient behavioral health facility for northern Wisconsin.
I'll second that.
Okay, any other discussion? I just have one point. Northern Wisconsin, is that north of 29? North of 10? Or whoever wants to go on board.
Hasn't been determined yet.
Okay, and that's okay. We'll take this port wherever we can get it. Okay, if there's no other discussion, I will call for a vote. Please indicate in favor by saying aye, oppose nay. Aye. It sounds like we have a unanimous vote favorable to go ahead and pass this motion and take it to the County Board of Supervisors. And with that, item number 17 is discussion and possible action regarding resolution 2924, which would be the resolution authorizing the creation of an ad hoc committee to pursue regional cooperation in the expansion of mental health crisis facilities. It is my understanding that ad hoc committees fall under the purvey of our county board chair as far as appointments. Would that be correct? Yes. Okay. I think we've kind of maybe covered our discussion. Is there?
I'll make a motion to approve it.
Okay. Motion was made and seconded to approve this with a positive recommendation.
Yeah.
To forward on to the county board for approval. Any discussion? Oh, and with that, I'll call for a vote. All those in favor say aye. Opposed, same sign. And the motion has passed with a favorable recommendation to the county board. Agenda item number 18, which is the legislative event report. Do we have anything to report there? Tanya? Malia?
John, Supervisor.
I'm on the 5 resolutions committees from Polk County, and our first one is July 2nd. And like I said, of all, there'll be one just on mental health. I'm sure you will be talking about a facility, and I'll get you all 5 of them. It's that dire need for Northwestern. And so I'll take the resolutions that passed by the county board. Been in touch with the chairman on the phone, and it'll be well, everybody, all the counties are usually attentive on the resolution. I think as far as we know, they'll be all in person rather than on a Zoom. Last winter, there was quite a few of them that was on Zoom. But now that it's summertime, weather's better, they called and asked us what we thought, and it was pretty unanimous that we want to be in person. Most of them were at Stevens Point, and I think from what Dorothy told me that he didn't know for sure. They're working on a couple of different facilities. There was some conflict in Stevens Point. And I'll keep on bringing everybody up to date. Call me anytime on anything.
Excuse me.
Yes, Chair.
I just want to add that the appointing Johnny as a representative to the Wisconsin County Association. I did receive a call from the executive secretary of the Wisconsin County Association in reference to my participation at one of the annual meetings, and I said, well, I'm not going to personally attend that. And she says, is Johnny gonna come? So we know that we're getting recognition down at the state level when she refers to John as Johnny as his first name.
Johnny P.
One thing that was kind of intriguing was for the 20 years I've been, every meeting I've ever went to, I talked about Highway 65.
Yeah.
And we finally, and we wanted to get some reconstruction done as far as the corners and with the new requirements as far as slopes and everything. We couldn't get enough money appropriated, but we did get it done last year and
Yeah.
blacktop shoulders and everything. So I finally had to shut up about it. But when they done the roll call, they never called me by name. They'd go in, Mr. Highway 65.
Now, if we can just get folks to slow down on it.
Squeaky wheel.
Yes, yes. Okay, that's what you've got for us today, John. Does anybody else have anything on that item? No, we will move along then. Subject matters for our next meeting on July 9th. We do have a work plan, but we do also have other items we may want to identify for our agenda in July. What the work plan is Golden Age Manor, child support, the VSO mid-year program, the 2025 budget priorities discussion instead of 2023. State and local budget updates on public transportation. I don't know, Brad, after your committee is formed, can we, I'd like to see it as kind of a standing agenda item throughout those processes, just so if you have anything to report and there's things going on or assistance you need from us, that you can give us an
Yep.
update on that.
That's fun.
Okay, great. Do we have anything else to identify for next month? Tanya?
I don't listen.
Malia? Nope. Okay.
Anya, or Madam Chair, I'm hoping
Yes.
that we can have something on Golden Age Manor next month. I'm working with trying to get a resolution
Okay.
together to take to these steering committees in 22 legislature. They passed the same amount of money as to support the county nursing homes. There's only 24 nursing homes left in the county. And we went from I think 933,000 assistance in 22 to 70,000 in 23. And what they did was like Racine County, some of the counties that were losing money, they allocated money like from Polk County to try and save them. And we'll be losing our county home if we can't get some money back. So that is one of the number one priorities that I'm going to bring forth. And there again, don't be afraid to contact legislatures.
Well,
I think Gail will tell you one phone call is worth probably 10 from any county board, isn't it?
absolutely. Yeah, and if there's a way we can help mobilize our citizenship as well, you know, for them to weigh in on it, you know, certainly, you know, many county residents and our citizens have been impacted by Golden Age Manor, you know, within their families. So certainly if we can get them involved as well, I think that'd be a great thing.
I think what's happened is people got just so relaxed that unless they're personally involved in an incident or something, they just don't make the effort to make that phone call or
Yeah.
or some kind of correspondent to the right people. And I know you legislatures, you're always taking notes and trying to listen. And that's tough in northern Wisconsin, isn't it, Gay?
Well, thank you, John. We will definitely we have a GAM on our work plan, so we will get that on our agenda next month. And thanks for keeping on top of that for us. Do we have any other subject matters for July than what we've mentioned today? Looks like we don't. And with that,
Make motion to adjourn.
Second.
any discussion? Motion's been made and seconded to adjourn. All in favor, please indicate aye. Opposed? And the motion is carried. We are adjourned. Let's take a break.
I better stay.